Good evening. I'd like to call this city commission meeting on Wednesday, May 4th, 2022 to order. We will now have the invocation by Mayor Pro Tem Harris. If we could all please stand.
Bow your heads if you would, please. Most heavenly and most gracious Father, Spirit of the one true and living God. Father God, we thank you as we always do for the opportunity to come together one more time. We thank you, Father God, that you have allowed us the use and activity of all of our limbs, the capacities of our minds, that we might do the will that you have assigned us to do, that we might be about the business of the city of Brunswick. Father God, I ask now that you will bless each and every person under the sound of my voice. God, I ask that you would galvanize us, that you will move us to another level of unity and camaraderie. Father God, I ask now that you would bless and lead our minds as we make decisions on behalf of our constituents, God, that's for the best interest of all of our residents of the city of Brunswick, as well as it extends to the county of Glenn. And so, Father God, we tell you thank you for these opportunities, for the appointed minds that you have set together to be on one accord. And so, Father God, we ask that you will allow us to move through this meeting on tonight and allow us to just be sheltered from any harm and danger seen and unseen. God, guide us in our thought processes and guide us as we do the best that we can by each other, because we are all citizens of the city of Brunswick. And so, Father God, the decisions and the trust that you have put in us and the trust that the citizens have put in us is not misled, Father God, but it is because we will do what's right for all people. And so, Father God, we ask now that you will extend your grace and mercy upon us and upon this meeting. In Jesus' name we pray. Amen.
Amen. Now we will have the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We will now have an approval of the current agenda. Do I hear a motion?
So moved.
Here in a first, in a second. All those in favor show by the usual sign of aye.
Aye.
All those opposed? Hearing none, the agenda is approved and adopted. Now we will move on to a presentation of the proposed 22-23 fiscal year budget by City Manager McDuffie.
I was trying to share my screen. Okay. Good evening. Thank you so much for the opportunity to present the fiscal year 2022-23 budget to the community and to the commission. I first like to thank the department heads who helped with the creation and presentation and development of the information that's going to be shared this evening. I especially like to thank the finance director, the HR manager, my executive assistant for putting up with me during this process, because they would probably tell you I've been a tyrant over the last 2 days. But we have a proposed budget before us. So with that being said, I'm going to try and navigate this on the computer so that it can be seen.
Are we following you in our binder or?
Yes,
what we were
you
sent?
have the full budget
Okay.
in your binders, and I will be providing a summary of the general fund budget and also an overview of how the budget is presented so that you can go through it over the next couple of weeks. And then we will come back together with questions and information that needs to be further provided in detail. The focus of the budget is basically to provide the proper resources for our city departments to operate and to provide adequate and improved services to our community. The primary expenditure, of course, is to support the compensation of our employees, which, as you know, has been a focus over the last couple of months. When we presented the package of increases for our public safety and public works departments, we did present that that would be, an increase, expense in the budget. So that is, incorporated in the budget and covered by the revenues that we'll present tonight. Basically, the budget, again, it doesn't have a lot of frills or thrills. It has adequate resources to make sure that our people are properly paid and that our equipment is properly maintained and our buildings are properly repaired. And basically, we can provide training and enhancement to our employees. Want to start by, look, our award-winning water tower. But anyway, in the budget, our first page is basically the provision of officials, including the mayor and council, current department heads and officials. I'll go on to the budget highlights. And I do have a transmittal letter. I'll go through the budget highlights, which covers most of the items in our transmittal letter. The budget highlights includes that the budget is currently balanced at $18,607,580, which is a 7.1% increase over last year's budget. The budget does include a 3% COLA, which will be effective mid-fiscal year. And it also has a $1 per hour increase for the general employees who did not provide any or get any compensation during the last salary proposal. The budget also supports 3 additional personnel or full-time equivalents. 2 of them are, one is a temporary position in the tax collection office. The other is in technology and the other is in public works. And I'll go through those in detail in just a few moments. The budget basically, again, it kind of push forward the things that we are already working on in terms of cleanliness of our community, housing improvements, increased demolitions of property in blighted areas. As we have done in the past, we've made technology upgrades and also infrastructure maintenance. The budget also includes $681,000 of equipment upgrades and replacements. There is no use of our fund balance, which at the end of last fiscal year was $8.6 million, but we are not proposing to use any of our fund balance to support the budget, but we did put in $500,000 of ARPA funds for revenue recovery. The budget schedule, of course, that was presented earlier. At this time, we are at the final budget preparation stage where I am presenting the budget to you this evening, Wednesday, May 4th. And going forward, I will be asking at the next meeting that the proposed budget be approved. At that time, of course, we still have the opportunity to review the budget and make changes, but we have to have it approved at that time so that we can meet the state requirement to publish the budget prior to the public hearing. The public hearing is tentatively set for June 1st, prior to the regular meeting, and that will be publicized as required. And based on the current schedule, we will be asking for the budget to be approved and all resolutions, including all the funds of the budget, on June 15th. Okay, moving to some of the detail. General fund revenues, of course, our revenues are specifically or primarily made up of our tax collections, our licenses and permits, and intergovernmental fees. The major changes in the budget, as I stated before, the budget is $18,607,580. That is a 7.1% increase over last year's budget. However, if you look at the chart that shows the revenues at the bottom, it basically states that it's 2.4% over what was collected in 2021. And the significance of that is that basically our budget projections are what I would consider conservative, because we are only projecting a 2.5% increase. And that has already almost been realized in the budget 2 years prior. So we basically have, a small increase in our revenues, and we feel very confident that our projections are sound. The main increase in our budget was in the sales tax, which last year we budgeted 6.8 million. This year we're budgeting 7.9 million. But again, in 2021, we collected 7.8 million. So we're very close. And we also projected a 4% increase in our property taxes. Other significant changes in our revenues, the permits and I guess fees that we collect for permits is down. And I wanted to note that, when we do tax abatements and there are people coming in asking for those things, that's some of the reason, but not the whole reason. It is dependent upon development. A couple of years ago, we had some large developments. We think that that's slowing down a little bit. So basically those revenues are projected lower. Again, under intergovernmental agreements, $500,000, that's from the ARPA funds. The only other significant change is in our municipal court fines, and those are slightly lower as well. We're hoping that those revenues will recover and continue to grow in the future, but of course, those are fines and they tend to fluctuate. Okay, if you look at, let's see if I can get the chart that shows our revenues. Again, our budget basically is made up of taxes, which the sales tax represents 42%. Our property tax represents 37%, and the other taxes, which come from insurance premiums and other things like that, represents 10%. So that's almost 80% of the budget. As you can see, the other areas are very small. Moving on to our expenditures. Most of the increases in our expenditures are from the increase in our salaries over the last year and in our health insurance cost. There were just a few items that I wanted to highlight in the expenditures. In the commission office, there is $150,000 added for the consultants or contracts that were presented earlier in the year. So that money is in the budget. In information technology, again, there were some increases for technological upgrades. In the tax collection, again, there was a position that was increased in that area. Of course, police, most of that is salary cost. And as you notice, the fire went down, but I think some of that is attributable to equipment that we funded last year and didn't have in this year's budget. Cemeteries and neighborhood and services, those basically went up because of some changes of positions as well. Again, the budget is 7.1% increase over last year's budget. Looking at the chart, you'll see that approximately 46% of the city's budget is in public safety, with an additional 13% from public works. So those three areas encompass about 60% of our budget. The only other note I'd make in that is that our government administration is still kind of at 8%, and that's kind of kept consistent throughout the years. The next chart includes just an analysis of our personnel cost and basically shows that our cost of personnel is $11,859,000. And that represents approximately 64% of our total budget cost. The salaries are budgeted at 9.0%. Health insurance at 1 million, well, I said 9.0%, $9.0 million, which is 76% of our personnel cost. The health insurance is $1 million. The retirement is right at $1 million. And then the Social Security and other is right at $700,000. Looking at our authorized strength that's supported by the budget, we have 215 full-time positions and 8 part-time positions. Again, about 170 of those positions, which I think represents about 76%, is public works, public safety. The proposed changes in personnel in the budget includes an administrative assistant that we have one in information technology now, but we are requesting that full part-time be made full-time. In tax collection, we have a temporary position, which we're asking to be made to a permanent part-time position. In public works, previously we had a Department of Corrections contract, and we are no longer dependent upon that contract because of the inconsistency of provision of skilled labor. So we are asking to replace that contract with 2 personnel added to our facilities maintenance area. Total cost of those position changes to the budget is $62,172. In addition to those changes, we, as I stated in my highlights, added a $1 general increase for employees, which would be effective July 1st at a cost of $98,000, and also a 3% COLA, which would be effective December 1st, which that would be for all the employees at a cost of $181,000. I have the fixed assets, and that's just a listing of computers, machinery and equipment, vehicles, infrastructure. That area includes body cams for the police department, turnout gear for the fire department, a large piece of equipment, a backhoe for the public works, and 8 new vehicles in various departments. I apologize for the size of the print on that particular document. I tried to get it to print out larger, but it just didn't. So with that, I will just state that the remaining information in your budget book includes, and I'm trying to get down to one of the department pages because okay. All right, so first off, it shows the summary of revenues and basically the line items for all the revenues in the general fund. And that is the first 10 pages of the worksheet reports that's in the budget. In addition, it shows every line item in the general fund in the departmental budgets. But in addition to that, I added some summary sheets for each department. And as shown here, the City Commission summary sheet, it basically provides a description. It provides a budget summary with the comparison of the 2021 actual, the 2022 approved, and the 2023 proposed budgets. It also shows that we don't have any commissioners. No. Obviously, we didn't put in, it should be 5 under other. My apologies for that. We'll get that corrected in the full budget. I was actually firing all of you all. No. But also for the departments, we have kind of some information that's shown as work productivity, and then the personnel kind of outline, and then major projects and expenses. And that's going to be for each department going forward. And just the departments have those summary sheets. But that's kind of, it's not only for you all, it's mainly for the public, because of course, the budget is available for public review. And I thought it would be helpful for the public to kind of understand more about, what's encompassed in the budget for each department in a summary format. I guess I fired the clerk too, because she has no people in her area. My apologies. I thought I checked all those, but it lists the employees. But going forward, all of the budget line items are outlined by department and following the summary sheets, and then the other outlines of the budget. The only other note I'd like to make is, some of the larger expenditure areas, I think a lot of times there are questions about what's included in general administration. And in that area, we have our claims, our insurance, liability insurance, workers' comp insurance, and then our electricity, which is about $500,000 for the electricity for streetlights in the city. And so that general administration has a lot of miscellaneous things, but it's outlined and noted in the line item budgets. We also, at the end of the budget, which is at the very end, let's see if I can get there. Well, basically it shows the transfers that we have, and those are large expenditures as well. We transfer funds for E911, transfer funds to support the CDBG admin. We will transfer about $450,000 into our workers' comp fund, and also about $150,000 into our group health fund this year. With that, I have my last slide, which says, oops, I think I went somewhere I wasn't supposed to. Which says that this is the proposed general fund budget, and coming soon, we will have the other budgeted funds presented or distributed. But basically, those are, smaller funds and mainly connected to the general fund. But we will send out that information soon. Okay. Are there any general questions?
I have one, and that's in regards to the 2 contracts that we have with the Bacon County Department of Corrections, what used to be the skilled workforce detainees that due to COVID, we could no longer depend on. Where are we with that? Have we canceled those contracts? Are they still coming?
We're proposing to cancel those
Okay.
contracts with the next budget year because of the inconsistency, because of the labor that they are sending is not skilled. And we are going, we're having a hard time managing our maintenance. We're trying to let them support it.
Okay, so, I'm assuming that y'all sort of looked at even non-skilled work that they could do that was less dependent on how many of the crew members showed up, and was
Well,
it just too hard to manage?
Yeah,
And-
when you're
okay,
paying $55,000,
Yeah. Okay,
you want to have consistent, proper maintenance. And we felt like it's, we could have people that we can have, schedule, we can have skilled, and we
Mhm.
can control. So it's more cost effective. I think we lose more money with the contract, even though, it seems to cost less, but the inconsistency of it, you don't know what you get.
so has there been any negative repercussions from, canceling that? Is that what we're doing? We're
Well,
canceling?
we're just not going to renew it.
Okay.
So basically, and at this point, they can't be negative. They've
Yeah.
been the ones who's basically not owned up to the contract.
Yeah. Okay, thank you.
Okay. Thank you.
On contracts, we had approved a contract for a company to work out at the cemetery.
Mhm.
That was canceled last year. We did not renew that contract last year.
We're gonna have the work crew for corrections in the cemetery.
Yes, we still have that.
That's one of the two crews? Okay.
Right.
So we're canceling one, but we're keeping one. Okay.
I tell you what I think about, I think we ought to keep our hand on the corrections thing and keep up with what they've got. I mean, we should have somebody in place over there. that, you know, we've done pretty doggone good. My experience with the labor and carpentry.
Well, I think what,
And the works that's been done through Signature Square. I mean, that just take it all encompassing, really.
well,
I don't know what that would cost us to do it any other way. But I think it's worth keeping our hands on. Julie's in that 100%. She probably has a pretty good idea of what it is. But I know we've got quite a bang for our dollars.
Mhm.
and I think in the past, what was there that's not there, not only the inconsistency of the crews and the skilled labor, the skill experience of the crews, but there was a person, and I can't remember the name, but he
George.
was basically one that could guide them. He was a very knowledgeable person in the work that they were doing. Now they don't have that guidance.
He went to work for us also, but he didn't say.
Right.
And we have the same kind of competency in the cemeteries too. And that sort of slid with Mark Bowen. I remember his name, Mark Bowen.
Mhm.
And I remember the other guy vividly too. And I mean, we just had exceptional leaders. There's no question.
It's
about
too
it.
bad.
They were exceptional.
And as all of our workforce is changing, that's one of the changes that we've lost. Going forward, there are dates on the calendar for review. If you all would like for any of the departments to come in to, answer any specific questions, please just let me know and I'll have them at those meetings.
Are we aware of any other counties that have a program like Alma did or Bacon County where they have skilled detainees or not?
I'm not sure. I really haven't gotten a lot into the situation. And normally it's based on that particular county and how they, their relationship with that particular facility. So really, I think I just need to delve into our relationship with the facility and if that can be, redone. I haven't met the warden or talked to that person. So it may just be us following up a little bit more and seeing what we can do.
I think that relationship dates back to 2005 or somewhere right around in that time period.
Okay.
Yeah.
Just a quick question. In those contracts that we have had with correctional facilities, are the men who are doing the work, are they being paid somehow through? Are they getting any kind of compensation for their work? Whether
I don't
through-
think so. I think what we pay for is for the guard. And that's basically what the city's contracts to pay for. As far as I know, I don't think they get any compensation for it.
So the city's,
The theory was they would gain a skill upon release. They would be in a better position for gainful employment.
And as far as I know, it was on a voluntary basis.
if I'm hearing it right, the city pays $50,000 or we were under, let's say, I don't know the exact number, but
Right.
that number, that contract was then paid to who?
The Department of Corrections for the guard.
For the guard.
Mhm.
And then we would use workers. And we don't know if they have any contractual connection at the correctional facility for their work at all.
Right.
Okay. Okay. Thank you.
I think what they did was they got to come to Lake County. The inmates. I think that was their, they got their day off. They didn't have to come over here. Be outside.
So, okay. Thank you.
Thank you.
They got to come to the beach.
So we don't have, there are no special call meetings in the middle of the day or, that type of stuff. No, I'm just asking now, trying to make sure we don't. Okay, thank you.
We appreciate you. Thank you for all of your work, City Manager McDuffie, and to staff who we know have been working long hours to get this thing moving. We'll now move on to our consent agenda items. Consider approval of April 20th, 2022 regular scheduled meetings. Do I hear a motion?
I'll make a motion to approve the scheduled meeting minutes.
Second.
Hearing a first and a second. All those in favor show by the usual sign of aye.
Aye.
All those opposed? Hearing none, the consent agenda items are approved. Moving on to our items to consider for approval. Consider approval of funding for Coastal Community Healthcare Services, City Manager McDuffie and Dr. Chandler.
Okay, I'm going to take this one sitting down.
No worries, no worries.
Yes, we have been requested to support funding for a clinic to be placed downtown in Brunswick and with Coastal Community Healthcare. These funds will be provided through our ARPA funds, which we feel that we want to provide sustainable provisions of service. And we felt that the healthcare would provide something in response to COVID to not only help the general population, but also those who were disproportionately affected by COVID and other healthcare needs. So the facility is on Ellis Street. It will be one to provide preventive care, and Dr. Chandler will go into much more detail. We are asking the commission to basically give us the go-ahead to look at entering into agreement with Coastal Community Healthcare to provide this funding. We will have to structure a legal agreement in order for this to go through. So we want the go-ahead to basically start working on that agreement going forward.
And
Thank
the
you.
county's participating as well, correct?
Yes, the
Yeah.
county does have this item on their agenda for the meeting tomorrow.
Okay.
Dr. Chandler, we thank you for being with us this evening.
Thank you. Good afternoon, Mayor Johnson, commissioners, city officials, and guests. I'm humbled to be here. On behalf of the community, my team, my board of directors at Coastal Community Health, I'm honored to be able to take part in this and share with you what our program does. Equally, I'm humbled that both the county and the city is considering funding and supporting this clinic that will provide the appropriate services. It is very unique and very exciting to see where there's a collective partnership both at the city and county level to support such an initiative. So as my time is limited, I always like to give the 5 W's. So forgive me if I'm oversimplifying this, but it kind of helps the community and others understand what we do considering our time. So my approach is, the question is, who are we? In essence, we are your community partners. We are established to provide a safety net for all individuals, those who are uninsured, those who are employed, those who find themselves at or below the poverty level, but equally those who have phenomenal health care that I'm sure you provide to your staff and others. What do we do? So the services that we provide social services and assist individuals with case management for housing, for job placement through partnerships with other local agencies. Our bread and butter is primary care. In essence, we provide the same level of care that you would get if you went to your primary care doctor. We focus on quality. Nothing that we do is short of quality in the primary care that we provide. Equally, We provide dental services. Once you are a patient of ours, regardless of which clinic you attend, you have access to our dental program that provides care at a reasonable rate. Again, regardless of your socioeconomic status, you'll have access. Equally, we provide behavioral health. And as many of you know, behavioral health has been and continues to be a major factor in our communities, in particular coming out of this COVID-19. And I'm very grateful that most recently the state has also acknowledged that and is putting in funding to support ongoing behavioral health services. So at the highest level, we understand the need for this. In particular, most recently passed was the co-responder bill, which will be working with local law enforcement also to be accessible to them to help de-escalate situations in which can save their time and costs, and also consider the individual as a whole before necessarily moving to place them in jail or otherwise. Where are we? As mentioned, we'll be at Ellis Street. Oh, and I forgot to mention dental. And one of the things that I also want to state is we are not a free clinic. At the same time, though, we are mindful of each individual that walks through our door, and we ensure that regardless of their situation, they have access. We take a full approach as a community health center. We are all across the nation and all across the state of Georgia. And as again mentioned, we are a safety net program. I think one thing is often missed, and I've been stressing with the city and the county in every meeting that I attend, is that you should see us as a fabric, a very part of what you do, whether it be the recruitment of talented individuals to come here for jobs, to attract talented folks. Too many people come here and want to establish a business, but perhaps cannot provide health insurance for their employees. It is worthwhile to express that around the corner, as we are redeveloping and developing the downtown, that you have access to healthcare, that we can do the appropriate occupational health. That should be a conversation that's had with all businesses that are coming here. People want a place that is safe, as I've always said. You want safety, education, and you want healthcare. And we have the opportunity to provide healthcare. The location is all about access. If you pull up the map of where we are and you pull up the closest healthcare facilities, you do not come across one that deals with primary care, affordable primary care, until you get to Parkwood, which is closer to the hospital. Many of the individuals that we've served, over 8,000 plus patients, most of those coming from downtown area, walk to our facilities, ride their bikes to our facilities. And in some situations, we provide funding to ensure they have access, whether it's through Uber or other transportation services. So we want to make the care accessible. Equally, this clinic will have a pharmacy in-house. And I have not mentioned the pharmacy as of yet, because we have a particular program called a 340B medication program. This program is only accessible to centers of our nature, as well as the hospital. And in essence, we are able to get medication for pennies on the dollar to then pass that savings on to the patients of ours. And that's all our patients. So I'm very proud to say that we will have a pharmacy set up in the next 6 months, as you have to go through the regulatory processes and so forth. But there is no pharmacy downtown. We're talking about access. We're talking about prevention. The work that we do is quite different from the work that the health department or the ER does, the hospital. Often we get a lot of folks from the health department who are sent to us for us to treat them. And then in the instances in which we interact with the health department specifically would be such as diseases such as HIV. Individuals can go there and get disease management, but after they leave there, they send them right back to us, and we deal with the preventive and ongoing care. Equally, the hospitals, we have a great partnership with the hospital, and it's necessary. The cost that is placed on the hospitals and placed in particular on our citizens to cover the cost of ER visits that are unnecessary is significant. We're talking about at times millions of dollars. Federally qualified health centers such as ourselves was established for this very reason, to save the city, counties, and others a significant amount of money, because we prevent them from getting to the point in which they need ER services and it costs the hospital and others more. Equally, we're providing an opportunity to keep people out of the ER so that we can save that space for those who truly need that service. So the partnership is great and we continue to build upon that. When do we anticipate that? We're in the process right now. We anticipate, as I'm pushing for the next month and a half, 2 months, to have the clinic completed, which you'll all be invited. And then equally, as I mentioned, the pharmacy will be set up, but the actual opening of the pharmacy really depends on their regulations. But I anticipate it's about 6 months before DEA and others can come down and assess it. The need is significant. There is no time like the present. What we've discovered over the last 2.5, 3 years is that we weren't prepared in many ways. And I'm presenting to provide opportunities that we can partner with you and our community members to ensure that everyone has access to preventive care. Should we hit another spike, whether it be COVID or any other matter, you have someone on the ground that's accessible that can work along with other existing partners such as the health department and the hospital. It has already been expressed that we anticipate a spike within the southern region of the state this summer, and equally perhaps a spike again of COVID in the north. We do not want to be reactive. Rather, we want to be partners. We were able to provide over 4,000 plus vaccines and testing, and again, providing that to individuals who otherwise did not have access. We did that through our existing clinics and our mobile clinic. We do provide some assistance and services to the homeless community with our intentions similar to that of those that fall within the justice system, to help hopefully get those who may be experiencing substance or drug abuse, to get them into a position in which they're willing to get ongoing counseling and get them off the streets so they can also be productive residents. We're committed to that. But as a community health center, again, we are the fabric of the community and we are multifaceted and we have the flexibility to work with your appropriate needs. And as I express, why is this important? Because access is difficult. Affordability is difficult. Accountability is what we provide. Quality is what we provide, and affordability is what we do. We do get support from the federal government, and as such, our quality of services is audited on a yearly basis. The quality that I personally do within my clinic is audited on a monthly basis and distributed to my team. So I can clearly show you the number of patients we see, the types of services we're providing. We can help assist you in identifying some of the main diseases you have within your city so we can look for additional resources to bring within the city. Just earlier this week, I was on the call with Augusta University and having discussions about expanding behavioral health services to this location and providing more personnel and training so we can expand. It is difficult at this point to even find an LPC, a licensed practical counselor, or a licensed clinical social worker. But doing the same at this point doesn't help. So we're in the process of trying to develop relationships that we can have individuals trained within our city. So hopefully they will stay within our city and provide the services that are needed. Again, I do thank you for your time. I do want to express again that we focus heavily on quality of service, affordability. And I want to express to you as I do not take lightly that we are asking for a significant amount of funds, but we are in a position in which the funds that we receive can be distributed to a significant amount. And if you have any concerns about how that fund is laid out, I welcome you anytime to my board of directors meeting as a guest. I welcome you to see the audits that are conducted by my board on a monthly basis. Equally, from a financial perspective, we're extremely responsible with our funds. And you can take a look at that anytime as presented to you here. But we also provide a third party that comes in and does an audit of our funds to make sure we're in compliance appropriately. And then equally, we have HRSA, which is the federal government, that assess our fund. They want to make sure they're giving their money and we're spending the right way. So I understand your need to understand what we will be doing. I'll be glad to present that to you at any given time. Again, we're grateful to be here. We're grateful to be working with all parties, whether it be the hospital, the health department, the city, and the county. And I'm so grateful that to be in a position, to be in a place where the city and the county are working collectively. So often we find places and individuals that are struggling to find that partnership. And I'm very proud and honored to be a part of the work that you guys are doing here. Thank you for your time. I can answer any questions that you may have.
When does your board meet?
We meet next week, Thursday, I believe it is. Yes, ma'am.
I'm sorry.
Next week, Thursday. And
Thursday.
actually this week, Friday, my finance committee is meeting, as I mentioned, to review our monthly finances. Any other questions?
Yeah.
Yep. Yes, sir.
Yes, the personnel here. I don't see an executive director. Is that your title?
Yes, sir. I'm the CEO of the clinic. Are you referring to the the budget for the downtown clinic or the overall organization?
No, this is the budget summary
Yes, sir.
that you provided in this handout.
Yes, so that one that you're looking for is the layout for the clinical cost of a downtown clinic, a full-blown clinic. And at this clinic, we would have 2 nurse practitioners, we'd have the pharmacist, a pharmacy technician, we'd have a licensed practical counselor who would also be present, 2 medical assistants, and 2 front desk staff, as well as we will equally provide, being part of our network, we'll also have access to our psychiatric nurse practitioner. And those patients at this time would also be able to go to our Shoppers Way clinic behind the mall to have access to dental care. In the future, our hope is to even make that more accessible as well.
One of the things that I've spent some time in healthcare, not on the financial side, but on the procurement side. And one of the things that I remember vividly that we always had problems with was the reimbursement of funding from the federal government. Do you get into that kind of?
We don't have that issue. And I'll be frank with you, it's like any organization. So we are a nonprofit. Having said that, the mistake that is made is that we still have to operate very much like you do or as a business. So we diversify our funding opportunities. We get a what's called a service area competition where we then get our grant funds that is already established. Obviously, like any organization, we have to get creative to provide other means. So for instance, the pharmacy program was created many years ago, the 340B program, where in essence, if you had medication that costs $10, the patient would only pay $1 to $2 with the thought that if you have insurance, we get the difference to then pump back into public services that we provide. So we are doing extremely well as an organization, as you can review from our finances, but we don't run into that. We kind of gauge that we can cover ourselves a full year plus if we run into those issues. But we continue to go after additional funds. And because of the level of oversight that we provide as it pertains to finances and our quality in particular, we're able to go after additional relationships and funding, whether it be, like you said, a partnership we have with Augusta University and others. So we don't necessarily run into that as much. And I have a phenomenal staff that pursues those fundings. And can I just say one other thing too, as you mentioned that, we know that there's been a significant decrease in access to physicians or just providers in general in rural areas. And I think that my desire along with the hospital and others is to try to get people to be down here and work here and see what we do so they stick around. So I think a rural health and what we provide is an opportunity for that. And that's something we're pushing through with some of our local schools.
But you don't operate from a CON.
No, sir.
The state does not apply that.
No, sir.
So what you said is that your financial picture has been structured in such a manner that you're not so dependent upon those federal funds.
Absolutely.
Because you have structured it to have revenue sources coming from different areas.
Absolutely.
Sustains what you're doing.
That's correct. Yes, ma'am. We have to be. And, I think that's the failure of a lot of organizations. I can't solely depend on just a patient walking through the door. And that is why equally and respectfully, I always start off by expressing we're not a free clinic. In my conversations and partnerships with the hospital and others, I express that we gladly would take individuals coming from the ER and elsewhere, but don't just send me your uninsured. What I want to do and what the intent of this program is to do that the additional funds we receive allows us to help those who fall below the poverty line, but I don't operate as if we are a free clinic. So as a result, we're able to be robust in what we do. And any additional fundings we receive only provide an opportunity to expand access.
And so it's the premise of a well established portfolio.
Absolutely. As you'll have in front of you, you'll see we have a significant budget that we manage and we're doing quite well.
Any additional questions for Dr. Chandler?
I think we in the county both look forward to participating with what you offer to our community and our full citizenry as far as filling in the gaps and the areas of true need.
Thank you.
As far as healthcare goes. So thank you.
Thank you all. Thank you for your
And
time.
definitely with the pharmacy.
Mhm.
Because I remember when I was a kid growing up, we had two pharmacies downtown.
Mhm.
We had the one right over here, City Drugs,
Mhm.
and then we had the one at the corner of Albany, of Albany and Gloucester Street.
Yes, ma'am.
I remember that, because we used to go and get peanuts and Coke. That
That made you well. huh?
made it real good. Cured everything.
Yes, ma'am.
I remember Rogers. Yeah. Yeah.
Privately owned. too.
Mm.
It was before Eckerd.
Yes, sir.
And then we got an Eckerd.
And soda fountain.
And CVS.
Yes, sir.
So that's a welcome.
Yes, ma'am. Thank you. Thank you.
No, we appreciate your work. I know it's been a lot of meetings with us individually, but also as a total with commission and also with staff. So we thank you for putting in the work and getting us the information that we need.
Mhm.
Hearing no other questions, I will entertain a motion.
Let's see what
Number
the
4.
motion is.
I make a motion that we move forward with approving the funding for coastal community health care services.
Second.
Hearing a first and a second, all those in favor show by the usual sign of aye.
Aye.
All those opposed, the same. Hearing none, the motion is approved. We thank you so much, Dr. Chandler.
Thank you all for your time and for your assistance.
Thank you. Thank you.
Moving on, we will now move on to consider approval of financial reports as of March 31st, 2022 by Director Mills.
Good evening.
For you, the March 31st financial statements. At that point, we are 75% through on the current fiscal year. You'll see on the general fund for the month, we had net expenditures over revenues of approximately $330,000, but year to date, we have net revenues over to a little over $4.2 million. And as I try to point out, the month of March is basically most of our revenue just would come from sales tax and normal things. We don't have a lot of property taxes or other things that have already been collected. So the fact that our expenditures are higher than our revenues for the month of March is not a surprise for us. Our cash balance as of March 31st is $9.4 million. Those funds are at sale. Like last month, you had asked me about the rates. In March, Georgia Fund 1 was paying 0.17%. Prime South was paying 0.875%, which is not great, but a lot more than we're earning at Georgia Fund 1. I did notice for April, they went up to 0.34%. So
How much the prime sale?
8 point something.
0.875. Our loss distributions for the month of March as compared to prior year at the same time went up $134,000. That was a 26.62% increase. Year to date, we are up $827,000, which is a 15.37% increase. And as Ms. Duffy was talking about the loss for the coming budget year, and we still have 3 more months for this current fiscal year, so we should easily see an increase of over $1 million this year from the prior year. However, the tax did go back up some, 27.84%, which only equates to a little over $6,000, but we're heading in the right direction. For the year to date, however, work expense or revenue is up $10,997. Or a total of 4.21%. Next page, you have SLOSS 6. I'm not going to go into a great deal of detail on that, because obviously we're not really collecting any funds on that now, other than a few little dollars that are coming in. The important thing is we have cash on hand of approximately $3.5 million. SLOSS 6. You can see our expenditures. We have expended our city funds for SLOSS a little over $12.5 million there in that little column. And so right now we are still paying out expenditures and finishing up some projects. So you can see all of those. I'm showing an allocated balance right now, $469,000. $244,000 of that is the interest that was earned on this fund. $209,000 is the overage in funds that we collected. Next page goes to loss five, and the number changes each month for the wage. We have $1,362,000 in there right now, and we have allocated that for reallocated it for purchase of the fire department ladder truck. Norwich Street Commons, there's been no activity in Norwich Street Commons other than it earns interest a little every month. We have a total cash balance in the prime sale of $337,000 in the Norwich Street Commons fund. Roosevelt Harrison Purpose Fund, looks like we've had total inflows of $270,000. 95,000 of that was money that we transferred over to the general fund to fund Roosevelt Harrison Center. We are at 63% of what we budgeted to transfer over, so we're at 75% of the year, so that's good. We're just good there. This cash balance is approximately $17,000. The ARPA fund, we have total funds available from the very beginning at $4,636,000. We have dispersed $82,434,000. And we have a remaining fund balance, which I forgot to change my lump down there. It should be as of 3/31/22. This says 2/28, but the balance of $4,572,000. The money that's expended, we have 6 grants that are being made under the Brunswick Downtown Development Authority Activities Program, and 1 grant that has been made or had been made as of March 31st under Back to Business Brunswick non-DBA. We have some that came in April that were approved by finance. Let's see, that's next month. Show it.
Is there a spin down time frame on that?
Oh, it's
Any of
an ARPA fund.
ARPA funds?
They have to be contracted by December 31st, 2024, have to be expended by December 31st.
Okay, thank you.
I have received some, a couple of emails in the last couple of weeks saying that we should be looking for the next, second half of those funds beginning probably maybe June or July. Basically, they said they would send us an email and let us know to go in and put those funds in Washington. Sanitation, total revenues, approximately $2 million, expenditures, a little over $1 million, operating income, $784,000. The cash on hand is $627,000 sanitation fund. And we have still money set aside for landfill, $194,000. So the sanitation building, trash pickup, $132,000 for the month of March. Here today, $1,156,000. Then it was revenues here today, $58,000, and street sweeping, $35,000. For utility, we have total revenues, $959,000, outputs $779,000. That's a net over for the year, $180,000. We have cash balance on hand as of March 31st, stormwater of approximately $645,000. There were no additional expenses in the month of March for control, traffic control, or recreation facility, or subsidized fees. So far on those areas, the only expended was $3,326 year to date for subsidized fees of recreation. The last page is Roosevelt Morrison. Let's see, we have total expenditures $13,309 for the month of March. Year to date numbers $3,000 approximately, and the majority of the funds spent at Roosevelt Morrison for salaries.
If you could talk.
Any questions? Any questions?
Primarily, Roosevelt Lawrence expenses are pretty consistent. And that's because those are just accounting for primarily salaries.
Yes. This, and then, you know, the utilities expense, that had a. Electricity,
Any further questions? Hearing none, will be open for motion.
I'll make a motion that we approve the financial report presented as of March 31st, 2022.
Hearing a first, do I hear a second?
Second.
Hearing a first and second, all those in favor show by the usual sign of aye. Aye. All those opposed, hearing none, the report is accepted. Thank you, Director Mills. We will now move on to consider approval of surplus property. Mr. Charnock.
Good evening, Mr. Mayor, Commissioners. Going to go over and present to you our surplus vehicle and equipment list from Public Works. All of this went before the Finance Committee. And, the purpose is to declare the listed items surplus so that we can sell and dispose of those properly. And we do that through public auction on govdeals.com. We've been very successful doing that. Occasionally, we do have surplus vehicles and equipment which are no longer used and may be too costly to repair. And those items are then brought to the City Commission to be declared surplus and are made available to the public for sale. The items listed below, and you've got a list there, have been replaced or scheduled to be replaced that are no longer needed. And all the items that are listed are in the Public Works Department at our facility on Whitlock. The items below are listed to be declared surplus. The knuckle boom has been used as a spare, but has already been replaced. The camera trailer was just replaced a couple months ago, so it is now available to be surplused. We have some golf carts and mowers as well. I've got a list there. I do have some pictures. If there's something that you want to see a picture of, we can try to see if we can share those with you.
Do y'all, I see the date that you have for, is that the year it was purchased or is that the year of the model?
That is the model year.
That's the model year.
Correct.
Okay.
And that's going to be very close to the purchase year. If we can get these up, then we will show them to you.
How many Skag mowers do we have?
There
in the
are quite a
repertoire.
few- There are quite a few. And the reason for that is that we cannibalize the old mowers and we
Yeah.
use parts. It saves us a lot of money by doing it that way. And so I can get these come up, y'all, but here we go. For example, this is our camera trailer. When we purchased this unit originally, it was $130,000 approximately. I've got some estimated values in the $8,000 to $10,000 range. The camera inside is what is expensive. It didn't come up. What's on mine? Why did it not share? Folks, there it is. All right. This is the first time I've ever done this on Zoom. I've been a bunch of Zoom conferences, so I apologize for my ineptness. But at any rate, that's the a picture of the trailer. It's got air conditioner on board. In the back, there's a section that opens up. There's winches and a camera just the lens on the camera was about $10,000. So, but it's a very narrow market also. So I don't know what we'll get at auction. We had as a trade, if we had gone with the one company we originally talked to, they were going to give us about 10,000 for it.
That was a pretty picture. Is the camera for sale that took that picture?
That's my iPad. But and of course, the mowers obviously are not real great state of repair. The other expensive item is the knuckle boom truck. And of course, we've replaced that. We did use this one up until probably about a year ago. We've pretty well quit using this one. It does need some repairs. I got a preliminary estimate of about $10,000 possibly for that. It could bring more, it's just the right buyer at the right time. So we've done real well to date. Since we started using Gov Deals, we're just under $400,000 in equipment and vehicles that I've been able to sell there. So you may, it was about 2006,
Got
I
your
think.
name on it. I see it.
So,
Judy said she's in the-
yeah, I didn't know if you had any other questions. Like I said, the mowers are pretty well standard fare, but what we plan on doing is once these are approved, if you will approve these tonight, we're going to put mowers together and make better mowers out of some of them. And that should increase the amount of money we can get. So some that have already got wheels missing and front suspension components, we can maybe get other things we need, starters or whatever it needs. So
How many operational skags do you maintain?
I believe, and this is off the top of my head, that we probably have about 9 or 10 right now. So we do have a large fleet. We have cemeteries, we've got, streets, we've got them all over the place. So. And we are still keeping back a few that operate. So if we have one breakdown, we'll still have some extras that we can put back into service. All right, if you have any other questions, but that's basically the list and everything we have there. I ran an ad. I've got 60 days to put these on sale without having to run another ad. So I think that expires the 28th of May. So I can still get these hopefully and get them surplus before the end of the month.
Any additional questions?
I'll make a motion to approve the surplus property list.
Second.
Hearing a first and a second. All those in favor show by the usual sign of aye.
Aye.
All those opposed? Hearing none, the motion is approved.
Thank you.
Thank you, Mr. Turner. We will now move on to consider approval to renew general liability and property insurance policy. Ms. Veely.
The City of Brunswick renews its general liability and property insurance coverage annually. The insurance is through GERMA, and the city participates in the GMA GERMA pool for insurance coverage. McGinney Gordon and Associates local brokers represent the city to ensure maximum coverage for the best value. With my staff report, there is an Excel spreadsheet that compares the years, if you want to look at it in that format. And I'm going to go through some of the increases and decreases. McGinney Gordon has secured the GERMA premium renewal for the coverage period beginning May 1st of 2022. The premiums or contributions increased from $383,571 to $416,723. This increase reflects a dividend credit of $8,843 from GERMA. That's one of our pluses for being part of a pool. We get to participate in savings through the dividend credits each year. The law enforcement liability increased slightly from $70,659 to $70,916. The increase reflects a law enforcement initiative credit of $17,729. The general liability portion of our contribution increased from $34,897 to $55,532. This increase was due, it's a 59.1% increase due to an 8% increase in our payrolls and budget and a 51.2% increase in the rate. Our crime decreased from $4,306 to $3,752, and public officials liability decreased from $77,500 to $76,837. Automobile liability increased from $98,005 to $109,648, and auto physical damage also increased from $38,963 to $43,517. Property and equipment coverage decreased from $63,672 to $61,223. The GERMA management fee remains the same as last year at $13,500. The fee due to McGinney Gordon increased by $750 to $12,750. This fee has not increased since 2013. The current policy coverage ends April 30th, or I guess ended April 30th. However, coverage will be bound effective May 1st, 2022 upon approval of the commission. The total budgetary cost is $442,973. The fees are included in the total budgetary costs. The fiscal year 2022-2023 budget has provided adequate funding for the renewal. And Fred is here tonight if he can answer any questions that I can't. Do you have any questions?
Thank you, Ms. Veely. Any questions?
I was just wondering why we had a decrease in the commissioners insurance.
Just, let's see.
I don't know.
You mean-
They're wild card.
Are you talking about the public officials liability?
Y'all done an outstanding job.
No.
Thank you, sir.
You hit the right answer. That's it.
There you go. There you go.
Good question,
That's the only
John.
question I had. I think you do a good job, Mr. Fred.
Any additional questions for Mrs. Veely?
I just say from the finance committee's vantage, we've had the opportunity to go through this with Lynn and get our any questions that we had at that time answered. So just to let the full commission know that we did have a chance to review it.
Thank you so
With that.
much.
Mhm.
And with that, I will entertain a motion.
I'll make a motion to approve the renewal of liability property insurance as written.
Second.
Here in a first and a second, all those in favor show by the usual sign of aye. All those opposed? Hearing none, the motion passes. Thank you, Ms. Veely.
Thank
Thank
you.
you.
Thank you.
Next, we will have consider approval of Community Development Block Grant Fiscal Year 2022 Action Plan. Mr. Bravo.
Good evening, city officials. Thank you for your time. I do appreciate that. The CDBG program this year, the action plan for the fiscal year 2022, we are hoping that we're going to get $383,000. That's basically a projection based on what we've seen in the past few years. Just to give a little background, there are certain percentages that we have to put in certain areas of the program, such as the MMH program, the demolition, public services, also what we call the admin section of the program. We try to minimize that section as best as we can. We try to shift money around, specifically in areas such as the rehab section and also the demolition aspect of the city. That's something that Ms. McDuffie, myself, and Sabrina have got together and pretty much make it stronger than it used to be in the past. We share the same ideas in that sense, and we're moving forward with those ideas on this fiscal year. We also, as every year, we try to reach out as much as possible citizens of the city and also beyond that. This year, it was very special because we actually went out beyond what we did in past years. Not only we use social media and newspapers, but we also built up a database with probably about 150 stakeholders, which includes the Chamber of Commerce, nonprofits, and private parties. We reach out to them and basically communicate what we're going to do during those specific meetings, whether public hearings. We did 2 this year. It is required for us to do that. And I have to say that they were very interesting because we went from about 10 to 20 individuals in the meetings. That's for us is kind of huge because in the past, for some reason, there was not much interest. So now instead of sitting, being a lame duck, we're actually reaching out to them and saying, hey, you need to attend because this is important. This is going to involve the community. This is something where you live. And I think that actually created an impact. And I think we saw the increase in attendance. So we did that. We provided both public hearings. And out of that, we came up with a plan. And the plan right now is based on our feedback. We plan to spend $200,000 on rehab. That pretty much breaks down to about 10 to 14 homes that we're going to fix for the city. In public facilities, we have one project right now, which is going to cost around $26,000. We're going to replace a roof and also fix a room for a shelter for teenagers that are being sex trafficked. So this is a really nice project that I'm looking forward to complete. For public services, we have a section there that every year we gather a group, a committee. Commissioner Martin is part of that group, and we try to be as fair as possible to all the nonprofits. This year we received 13 and only 6 made it. And basically what we do as a city, we provide the facts to the board and they decide what to do, how to pick them and what money to spend. We just give them the full amount of the money that we have for that year, for that budget. And they're the ones in 4 hours have to come up with the actual sub recipients for that year. And the system works. This is something we've been doing for 2 years to make it really fair to everybody. And the board is very diverse. We have different people from different backgrounds and it works. We realized that what we did, we really accomplished something this year, just like the year before. For that section, again, is $60,000 for demolition. We didn't have a budget that in a couple of years, but this year we're going to add more to it. So we have $50,000 for demolition. On average, you're looking at about $10,000 each. Give or take, the target for this year is 3 to 5 homes, basically that are structures that are truly beyond repair. Then for the administration aspect of the program, we are at $45,000. We decreased that amount because we figured that we were using too much of it, $74,000, and we shifted that money around between demolition and also the MMH program. So pretty much that's what the annual action plan is going to look like for the fiscal year 2022. If you have any questions, I'll take those right now.
No, I appreciate the involvement. I had an opportunity to provide, and I think y'all have done a great job reaching out, making the community aware of what's available, because it all goes back into our community. So
Yes.
I think y'all have done a great job. I
Thank you.
mean, you're right. The attendance and the outreach has really been effective.
Yes.
And I think y'all, hopefully can continue forward in what you do, because it is effectively having a positive outcome in the community.
Thank you.
Thank you, Mr. Bravo. I think my initial question was kind of in my review of the expenditures for CDBG,
Mhm.
when I see major minor home repair, things like that,
Yes.
I'm consistently seeing one contractor be used
Mhm.
kind of for that stuff. I think my deeper question about outreach and kind of what we're going to do with this plan is that I see, especially major minor home repair, as a space that we can definitely use and start to uplift minority contractors throughout the city. And I just want to maybe ask a question for, yourself, City Manager
Sure.
McDuffie, or Dr. Nixon. Where in the plan do we start to think about how we reach out to those who are doing the jobs for us? And I know that's on top of your base job of just kind of making sure homes get torn down and fixed and all of those things. But where do you think we could start to have a little bit of focus put on that? And that could be from our vantage point or to be done through CDBG.
That's a question that I ask myself all the time, to be honest with you, for the past 3 years. And the last year, we basically tried to be more proactive. We reach out, I think, about 50 contractors. We prepare a packet. We put an ad on the paper. We use social media also as a vehicle to inform the public. And out of that whole group, we only got one response. Out of that response, we informed the contractor that we had a house ready for him to look at it, and we set up the appointment, and he never responds back to us. So for that matter, the one that we have right now, which is Stephen Golden, he's very reliable and he's always there, and the quotes are always on time, and we can turn the homes around to the speed that we need to. So right now, we're probably gonna get together again for the new fiscal year and find a way to somehow find more contractors. Right now, I don't know what exactly we're gonna do, to be honest with you, because we already tried something the past year that unfortunately, the community or the contractors that live in the community they just don't respond.
Can you walk me through a little bit of what's needed for someone to get a contract with the city in this space? Is there a particular type of bonding? Is there a
Yes.
particular type of insurance? So
Correct.
is it possible, and I not that we don't have that place somewhere, but I think it's important even in this public forum that, people maybe not realize that it's a blanket. Anyone can come in. You got to have a certain amount of hurdles.
That's correct.
The reason it's important for me as a leader in the city, I know we may be on a 1 to 2 year trajectory of getting people ready
Mhm.
to apply for these contracts, but starting to have an understanding of what they need as a basis and focusing in kind of on
Correct.
this plan as we direct more dollars.
Mhm.
I want to do that. So what is some of if you could give me maybe some base kind of things that a contractor has to engage with the city at this level?
I think there's quite a few, but I mentioned the ones that I've seen. One is the liability of the contractor with the city. That's one of those. The insurance. We're basically having a contract with the contractor, and the contractor has a contract with the property owner. So there is a big liability there that the contractor is responsible for the home, for damages, and also for the workers actually doing the work in the property. That requires, I think, it's close to $1 million bond for the contractor to have, including life insurance for those who are in the property. So I think that right there is a big turnoff. The second one, I think, also has to do with the properties themselves.
Can I ask a quick question?
Sure.
there? You said they got to be bonded out to $1 million and
Close,
then
I believe so.
have health insurance or life insurance.
Life insurance, correct.
For all of those employees. So is that, and correct me if I'm wrong, I'm trying to figure
Sure.
out, does that mean none of their workers can then be contracted out? So they all must work under a company umbrella that provides?
Pretty much, that's how it works. They have the subcontractors, and that's the umbrella is going to protect them when they do the work.
So you can have a life insurance policy on the subcontractors though?
Sure, I'm
Okay.
sure they do that.
Okay.
We do the checks, and they do have them. They provide their licenses have to be updated. They don't have to have any type of issues, financial issues.
Gotcha.
For that purpose, we run them through the SAMS.gov site, and that will give you any red flags that has the contractor. I think 2 years ago, I ran one of them that came to the city. I mean, the guy had a list huge list with a bunch of red flags in it.
Yeah.
Thank you for applying, but no, thank you.
Right, right. No, we
You know what I mean?
understand.
So a high risk, you know what I mean? We could consider, but it is a risk. The other one is the actual construction itself. It's the homes that you're dealing with, they're very old and decayed. And for contractors, sometimes that becomes an issue, such as they're responsible or the warranty that is in the contract is for 1 year, meaning anything breaks that they fix, we don't pay anything, they have to go back and fix it again. So that's an advantage, but at the same time, the homes, because they're old, they require high maintenance, some of those. And I think that's one of the issues too. When they see all the paperwork that they have to get to actually get to the house, it becomes an issue. It's almost like, do I really have to do all that? And the fact that we're not doing large scale, we're doing, 3 homes every 2-3 months, all the paperwork that involves the environmental reviews, historical reviews. If you touch a home that actually has a historical value, if we replace any windows, we have to make sure the frames of those windows are going to look just like the original ones.
So at this point in time, am I hearing that Mr. Golden is doing all of those things by
Correct.
himself? So
Oh,
he's
yes.
doing the
Mhm.
environmental stuff, he's doing.
Well, we do the environmental, we
Okay.
do the historical, but
Gotcha.
they have to attach to
We
that.
gotta, you gotta follow those guidelines.
Pretty much, I go up there and make sure they do what they're supposed to be
There you
doing,
go.
make sure the frames look the same.
Mhm.
We take pictures, we go through the whole motion
Mhm.
with them. Basically, I work with them from the beginning of the project all the way to the end.
Okay, okay.
So we pretty much have eyes on the field when we're doing a project. It's not something that we do only on paper and then move into the next. Part of that is obviously the paperwork, but at the same time, you do have to go up there and actually do the visual of the project, and you have to make sure they're replacing what they are saying they're going to replace, and it looks the way it's supposed to look at the project. So
Is this the same amount of guidelines or the same kind of guardrails that are used for demo?
pretty much it's almost the same as far as environmental and historical, but you have more latitude with the demos because demos are basically falling apart.
Uh-huh.
So it's really hard to have somebody going in the property with the liability issues.
So, but I guess I'm trying to figure out, is there still the same insurance bar? There's still the same $1 million bonding life insurance? Is that all the same for a demo project?
That's a little different because sometimes we do use Public Works for that. We have a
Okay.
project that we did for Public Works and they were the ones who took care of the problem. So
Okay.
those are falling within the city. In some cases, we were outsourced to Roloff, I think is the name of the company. They'll do the same thing. It's a big company.
Okay.
But in a way, yes, they have to have certain type of liability to protect themselves and also some to protect the city.
Okay. I want to say this would be my last statement that
No, that's fine.
I'm thankful for the money that has been moved over to demolition, the additional funds that have been moved over to major minor home repair and things of that nature. I do want to make sure that as a commission and
Mhm.
as a department, that we are taking the time to try and find out as many different ways to involve, especially when you see only one contractor consistently. And there's nothing wrong with Mr. Golden, God
No.
bless him, but at the same time, we want to make sure that that's being spread out through the community. So if we can start to build something that teaches, whether you're just the handyman right now and it's a 2-year process to get you to where we want you, I hope that we can engage in that process. So,
Yes, no, and we're being proactive with those that are interested on. We do give them guidelines and say, look, this is what you need to get to this point. You come back with those credentials, you will have work with us. Because the goal for us is not just to have one contractor, because it make us, I guess, attached to one person, and we don't want to be attached to one contractor. We want to have that freedom to move around and say, well, I'll give you 3, I'll give you 1, I'll give you 4, and everybody benefits from that, so. But yes, we'll definitely be more proactive when it comes down to that.
We had one person that did on these type jobs,
Mhm.
construction jobs, he was from Waycross. Do you remember, have you seen any, you weren't here?
No, I wasn't here, no.
I don't know where's Golden from, is he from here?
Yeah, he's from Brunswick.
And we really looked into that extensively. I mean, I want our money spent here in Glenn County, in Brunswick, if we can do it. Every nickel all that we can spend, we spend right here. But we could not find, and this guy was around for a good while. He got everything. He was front Waycross? Can you remember?
I don't.
Mm. We went as far as Atlanta last year. So we had a contractor coming from Atlanta, and unfortunately, the quote he gave us was for Atlanta prices. So it was beyond what we could. I mean, the quote was for the full amount of the entire budget for the year. I said, look, thanks for coming, but it's just not based on the market value that we have here in the city of Brunswick. And I never heard from them. So
That is one of the deal breakers, is because they have to be able to qualify through that SAMS program.
yes,
And so there are other, so many other federal regulations that they have to be able to meet as a contractor, along with the city's requirements.
correct.
They've got the city's requirements and the federal requirements. And so most of the locals here are not at that level that they are able, they may get past the city's requirements, but when they've got to be ran through that SAMS program, which has stricter federal guidelines and stipulations and requirements, then, and the paperwork,
Yes,
and they don't have the capacity to be able to do that stuff, then it is a turnoff.
it is.
For the return on investment
Yes.
that they're going to get. So it is a turnoff in that aspect. But I know a couple of years, well, not a couple, maybe about 3-4 years ago now, there were some others. So maybe you all can look at some of the older lists, because I know there were maybe about 2 or 3 others
Mhm.
that had actually come in. I think a couple of them may have had maybe some small hiccups, but all they needed was some guidance and being able to submit the paperwork and knowing how to submit the paperwork and stuff. I think Travis at one time when he first came in, he was supposed to be trying to help in that area to be able to get them qualified in areas that they were not qualified in, because that was our expectation of
Right.
him as the economic development director.
Correct.
Was
Yes.
to help these people to be able to get, in a better position, thus the birthing of the what that thing was called? Micro something business program
Oh.
Mhm.
that was.
You basically help
Yes,
the
yes.
small contractor to get to the
Yes.
level that he can
right,
apply for bigger jobs.
right.
Yeah, and there's some of the issues too, I think I've seen is that the jobs that we do, they go up to $15,000-$20,000 depending on the market value of the property, which a lot of them are very low in the low end. When the contractor sees that, they said, well, if I'm gonna get a big hitter for 3 homes for $30,000, I'd rather go and get one house across the island and get paid $150,000 for one roof. So you can see how the difference for them, and then carry on all the headache that comes with it. I think that's also part of the turnoff. But, we're doing our best to be proactive. We encourage those that are interested to coming into the city. And we still continue using the different vehicles to communicate with the community, such as social media, newspapers, and sending massive emails, the city website. So we're trying to do our best to reach out, and hopefully this year things will be a little different, and we'll continue being proactive when it comes to that.
Have you all looked at like a fast, I'm sorry.
No, go ahead.
Like a fast track, is there a fast track process that maybe a scaled down track where they may be able to meet this, and even up under Goldman who is there,
Mhm.
then others can be brought in like in a training capacity, but it's like a fast track program. I don't know if they have one, or even if we can be the originators or trailblazers of such a program.
That's an
that
option.
helps to,
Mhm.
move. That's just like with other contractors. You may have the general contractor that has all of the credentials, but then
Correct.
he's got those subs that come in
Correct.
up under him. And then I had another thought. The demolition. I
Mhm.
am really glad to see money's moved over to that,
Yes.
because I remember when I first became a commissioner, what's his name?
There wasn't a lot happening with demolition.
It wasn't, but before he left, that's him, Dick. Dick had started getting monies positioned to be able to do more demolition.
Mhm.
And so now I'm glad to see that progressing back to that point.
Yes.
Because after Dick left, it's like, I don't know what happened with the demolition area, but so I'm glad to see that monies are being funneled over into that area to.
We partnered with John Hunter. And basically, we had I think 2 years ago, we started talking and then apparently there was some budget at one time, then it was cut off at one point, and then it kind of shifted. And at that point, I said, why don't we make the demolition part of the program, throughout the years? This is a 5-year plan. We're in the 3rd year right now. When it's time to do the 5-year again, we can include that into the program. That's going to look even better for the city. So we've been doing, I think we did so far 3 or 4 at this point, and we already have, I think, 5 more lined up waiting for court orders and that sort of thing. So that I think the process is taking off little by little. Eventually, we want to get it to the point that it's going to be like the MMH program, which is we keep turning houses over and over and over. It's not something that we stop because we're just going into a new fiscal year. We just continue shifting over and over those homes. And you don't have to apply for those on a specific time of the year. You just go and apply for it. It's a 365-day process. And we want to make sure the community understands that, because some people think that it's only open during the season that we're going to receive RFPs, and that has nothing to do with that. So we kind of clarify that to the community. No, this is very different from what we do with public services. This is something that is for you. You can come in anytime and apply for these grants. You don't have to pay it back. You don't have to do anything. If you qualify, then you'll be granted the money, and we'll provide the contractors, and we'll give you 1 year of guarantee on the property. So it could be fixed if something breaks. So.
Is there a certain time where contractors can apply for, like, how does that work if a contractors?
We're open all year. They can apply anytime.
How can they go on the website and do so?
They can actually call me. They can come to the city. We have a packet that we created a year ago, and that's the one that we provided to those who are interested, the ones that call the city. I can put the packet in the website and in the section for CDBG.
Can you email it to me?
Sure, I can
Okay.
send you an email.
Thank you.
Commissioner Roll, I think, brings up a great point, though. If we can at all, digitize these packets and information so we can point people, directly to the packet first, and maybe a small 1-pager of, hey, this is what you need, but that'd be perfect. Any additional questions for Mr. Bravo? Hearing none, we'll entertain a motion.
I'll make a motion that we approve the Community Development Block Grant Fiscal Year 2022 Action Plan as presented.
Second.
Hearing a first and a second, all those in favor show by the usual sign of aye. Aye. All those opposed? Hearing none, the commission passes. Thank you.
Thank you very much, City Official.
Thank you.
Appreciate it.
Thank you.
Thank you, Dr.
Now we will consider approval of an agreement with the National Sign Plaza for installation of the City of Brunswick wayfinding signage. Mr. Nelson.
Good evening, Mr. Mayor,
Good evening.
Mayor Pro Tem, and Commissioners. Thank you for your time, your consideration. A little history of this project began back in 2017.
We
Yeah.
were here.
You were here as a joint venture between Glenn County, City of Brunswick, and the Visitors Bureau, Visitors Bureau. The attempt was to standardize the signage, wayfinding signage around the area. CVB was spearheading this project, so and in their research chose National Sign Plaza out of Atlanta to design, facilitate, and install the signs. Through a lot of hard work, we have finally gotten to the point where the signs around the city, downtown and around the areas have been designed. They have been submitted to GDOT for approval. As it stands now, as of this morning, they have been approved and ready to move forward. What we're asking, there were $259,500 that were allocated for this project. We were able to secure a contract of $155,000. So that's a savings of $104,500 for them to fabricate and install the signs. And we're at a point now where we're ready to approve a contract to get them moving forward. I spoke to them this morning. They would be looking at a schedule of fabrication by the end of July and install at the end of September. Oh, these are our signs.
I was looking at those yesterday.
So we're using, I thought there was discussion at one time that the oak was going to be more the CDB or the county, and the city was going to have its own.
Quick lesson on that. This has been very educational in the world of GDOT. They have a book of standards
Oh, yeah.
that will tell you size, shape, listing order, directional turn order,
How to tie
size
your
of
shoe.
sign. And
Yeah.
when this was handed to me a year and a half ago, we had 6 different size signs that they had presented. We're down to 2. This is the majority of the sign sizes. The signs that would be located on 17, the Causeway, and the Spur, due to higher speeds, required larger signs, visibility, a larger lettering. But yeah, GDOT will tell you how it's supposed to look, where it's going to be located, how many feet off the white line, how many feet off the center line, how many feet from intersections. We even tried to re-list some signs and were rejected because it was outside their design requirements. I'm sorry? All the signs will be on metal breakaway poles, which is for the installation process is 2 steps, because all the signs, whether they're downtown or on the higher speed areas, have to be mounted to concrete bases. So these will be single poles. Yes, sir. Larger poles will be on double poles. The larger signs will be on double poles.
Those are more.
We scale that down. That was going to be almost 7 feet by 7 feet. And we went to Waverly and looked at their signs that had already been approved by GDOT, and were able to show a size that they had already approved. So we're 1 inch larger than they are at Waverly.
But you still didn't quite answer the question about the logo.
There was the only logo change that I'm aware of is this at St. Simon's had a little bigger scallop to it. And they found that because of the winds, that created a weak spot right here, and it was snapping the top of the sign off. So this was reshaped to have a lower profile to eliminate the wind drag. But as far as lettering, the difference in the lettering, this is their standard approved.
No.
lettering.
I'm
And
talking about
Commissioner-
the tree.
A tree,
Commissioner,
Logo.
yeah.
Commissioner,
That.
the logo was what was given or presented in the package when we got it. And basically that was, well, again, I came in, once this project was 2 years old or 3. And that was the logo that was presented for the city of Brunswick. Or, as a standard design for
Yeah.
all of the signs. So we basically thought that everything, and again, I thought all of this had been through an approval process. None of it had gotten as far, as we thought. Like Tim said, the sign sizes, the directional arrows, the placement of the sign, all of that had to be redone. And I don't know, I haven't seen any other logo. So that's the reason that one's there, because that was the one that was on the package of signs, and all of those signs were, basically set up when I got here. and when
Okay,
Tim
because,
got here.
correct me if I'm wrong, some of our more seasoned commission, that the logo right there where the tree is would be the paddle boat. I mean, it's the steamship on our seal, on our city seal, and that would sort of designate the city that's
for the
within the
county.
city.
Yeah.
And that was more
For the
Convention
island.
and Visitors
city-
Bureau, the
CBV.
island, yeah.
Well, I will check to see, but again, that, I don't know. And if you all would like to see, because we haven't fabricated any of the
Okay.
signs. And I'm assuming that, although GDOT has its specification, if we keep something within the,
Mhm.
I guess, the parameter of what's there, we may be able to replace it. But I'd have to go to National Sign Plaza and see if they even have that on record. And if they do, they may be able to do that.
Yeah, because that, I mean, that's just a printing
General.
logo. The shape, the size, the conformity, I think is important to carry through the island, the mainland, the city. But I think originally, the differentiation that you are in the city and this is part of the city was to have the steamship off of the
I'll
city
check to
seal.
see. I have not seen anything in all of the information that was passed along that shows that.
Yeah.
But I'm assuming that if we can get something and maybe National Sign Plaza has something that was given to them way back. And we
Okay.
can check to see if that's
Because
available.
that was the main reason when, I was pushing for the monument sign right there at Highway
Mhm.
17 and Gloucester, and then the one farther down at Fourth Avenue was to incorporate that same logo because that was going to be carried forward.
Okay, well,
But-
we'll certainly check into that and see if we can get that done. Hopefully, like I said, as long as GDOT doesn't have to
Yeah.
reapprove everything,
Yeah.
maybe okay.
I mean,
with
it should fit in that same area.
Right, in that same, in the same size.
Yeah.
We can,
And Gero
that.
may have, he may have some of the artwork that was incorporated when the monument signs were done.
Well, I've been dealing with the VP for about the last 4 or 5 months.
Mhm.
So if anybody has that, I'll reach out to him in the morning
Okay.
and see if there's any record of a different logo than.
Yeah. I mean, if we're too far past it, I understand, but hope, that was the thought process back then.
Mhm.
Yeah. Are y'all in agreement with that?
Yeah, we want it to be differentiated between the. But.
I think if
I
to
mean, it's a
resurrect
nice
my
tree,
memory, I
though.
think we went to GDOT. They had intended at some point to have different colored signs based on city versus county, if y'all
Mhm.
recall that.
Yeah.
Yeah.
GDOT said no way, had to
They
be
said no.
uniform sign colors. But I thought there may have been some sort of resolution by saying, can we just utilize a different logo?
Yeah.
I think that was okay.
Okay. That looks good though.
Mhm.
For those of us that are sight challenged, it looks good.
I can see all those
That's 5
letters.
years in the making.
I can see all of those letters. Yeah.
Question for City Manager McDuffie. In no way are we locked into anything by right now approving the agreement to go to work with them, right?
say that again.
Commissioner Martin wants, and I think we all want to see some difference in the signage or in the emblem. So this being approved tonight doesn't lock us into
No.
that. I just want to make
No,
sure.
not at
Okay.
all.
Let it lock us into that.
No.
Okay, perfect. Any additional questions?
So,
Let me ask for my own.
Yeah.
Clarification. If this is an issue with GDOT, if they say you're going to have to resubmit all the signs again, is that a road that we want to go down, or do we accept this and move forward?
they could chop the tree down and put the steamship in the exact same spot.
I'm only asking because I've fought this battle now
No,
for a
I
year and a
know,
half.
I know.
So I know where they're going to go with it. So I just need to, if they say they don't have any record of it, or they found it, what's going to be required by GDOT?
So GDOT versus wayfinding signage, the National Sign
No, the
Plaza?
signage, company, they don't care. I mean, they'll do what we tell them or what we ask them to put on the sign. GDOT, again, they have specifications on the size of the lettering and all of that. But like I said, what I would ask them or tell them is that we will put the design, the only thing will change, not the size, not the coloring, basically just a different emblem.
Yeah.
So hopefully that won't be an issue.
Okay,
And we, we'll fight that battle.
okay.
Okay.
Do you
Yeah.
remember that, Brian?
That's my recollection. That was sort of the resolution of them shooting down the two different types of two different types of colorings on the signs was to say, okay, I think we can ask Scott too at CVB. I thought that was the resolution to say, all right, we do want them differentiated between mainland and the island, and maybe we could just, again, in the same footprint, put two different logos. So there's some idea there.
Yeah.
That's my recollection.
Yeah,
Yeah,
okay.
and we have been in conversations with Scott, and I guess Garrow was here when it started, but that had not come up. But I appreciate you bringing that up, and we'll certainly try and address
I
it.
mean, I don't want to derail it. I know a huge amount of time and effort y'all have spent, because it kind of got dropped, picked back up, and y'all didn't have the history of, when it
Right,
first
and-
started.
And believe you, we have been working for a year and a half
Mhm.
constantly through this process.
Yeah.
It has not been delayed other than with the approval and the permits and all of that.
Mhm.
So,
Mhm.
but we'll check into that and get back. with you.
Mhm.
Well,
Thank you.
Thank you. I appreciate
Well,
that.
I'll make the call in the morning.
Okay.
We'll find out.
Okay, thank you.
Thank you.
We can get a steamship for another 100,000.
Yeah.
Hey, forget about that ship. Let that ship sail.
Do it like we did the Lover's Oak. If it doesn't work, we'll plaster.
Yeah,
something.
okay, there you go.
And with that, we'll entertain a motion.
Well, I'll make a motion that we approve the agreement with National Sign Plaza for the production and installation of the City of Brunswick wayfinding signage at $155,000.
Hearing a first, do I hear a second?
Second.
Hearing a first and a second, all those in favor show by the usual sign of aye. Aye. All those opposed, the same. Hearing none, the motion passes. Thank you so much.
Yay, we're glad to get to this point.
One step further. We'll now move on to city attorney's items and discussion of proposed ordinance number 1074, short-term rental.
Okay, good evening, Mayor and Commissioners. You should have before you in your packet a red-lined PDF version that shows the changes to the ordinance. Does everybody, okay.
You sure?
But there have been significant, sort of a significant update to this current draft. We had the audit committee meeting last week, or maybe the week before, wherein the current or the past revised version of the ordinance was discussed. There was an at-length discussion regarding the cap and percentage, which, if you guys recall, in April, that was sort of the whole discussion with the commission as to how we move this forward. Are we comfortable with percentage? What has come out from that and what is still being researched at this moment is the legality of the cap. There are communities that have put a cap in place, specifically Savannah. Atlanta has recently rolled out a new short-term rental ordinance that does not contain a cap. I'm feeling amongst the feedback from GMA that it's something that everybody's sort of looking into and researching and making a determination. In an effort to, I think, push this, I don't want to say cram it, through the process, but to put something on the books in the city of Brunswick so that we can begin the process of, contracting with third parties to observe and review the compliance with this ordinance, to start capturing any hotel motel taxes that we are missing, and to provide some regulations as to short-term rentals within the city. I think it'd be best to get an ordinance that I think is substantially, that would substantially complete all of those items. I know that it is the direction of the commission to continue to research and determine the best mechanism to place protections within the ordinance that protects the neighborhood, that protects the neighbors, and that protects, I would say, property values and how we address the community as a whole. It'll be interesting to see a little bit of the case study that comes out from Atlanta's as they sort of work through their process. But at the moment, the revised version you have before you, I just pulled out the definition of owner occupied. I pulled out the cap in general and the split of the two wards of the city. I did that because I think it will give us time to research it. But I also left in several items that were from the audit committee, suggestions, including transferability of certificates. We don't need to worry about grandfathering at the moment because the cap has been removed. The no, visible changes to the appearance of the properties, no advertising, those types of things. The local point of contact, the ability to change or temporarily name a new person. So I'd say 80% of the changes suggested by the audit committee were incorporated into the ordinance. Obviously, the main one that they wanted to see and discuss was that cap. So the ordinance is still very uniform with Glenn counties, which I think is a good thing. And it will still provide that process by which people come in, obtain their hotel motel or short-term rental certificate, and then the city can begin to, sort of realize the benefits that are included in this ordinance as written.
Thank you. Any questions?
As far as administration, are we planning to mirror what the county's doing as far as the same folks that are overseeing the software, the program?
We haven't, I'll talk to John about that, but I think we'd need to get the ordinance in place first and start the courting process, I guess you could say. That would be something that needs to come back to you guys for approval. So if we select a third party, it would be you guys selecting it and signing a contract to work with that. I know that I think I've presented in the past that the county did provide John and I their numbers. I think they went from 66% compliance to 76 in the first year, and they're expecting an increase maybe into the 80s on the second year. So it certainly seems like it's working at that level. Obviously, goal would be 99 to 100%, but I think that's sort of how you have to work through this. One point that we may want to take into consideration is that this ordinance, remember, was initially presented to you guys, not all of you guys, but most of you, in November of last year. At that time, we had built in that the effective date would be July 1st of 2022. And that was to try to, give us a cushion up front of 6 months to have those conversations with the third-party vendor and hopefully get that in place for when the ordinance becomes effective. We've pushed, well into the cushion that was sort of allotted. And I don't know if John and I could get everything done between now and July 1st to have something presented to you guys. It would have to be probably second meeting in June. And I just don't know if that's something we could get all the way put together. So we may want to consider an effective date of January 1st or maybe later in the year, maybe the third quarter. So October 1st. That would give John and I the ability to sort of roll this out and get with staff and, Lynn and everyone that is going to be having the intake and with the public and taking that all into consideration. That I don't think we need to start it and then expect compliance, that quickly.
I think that's very reasonable, Brian, because the public really needs to have some time to get committed to this too. And by the way, I have just put my place in front of me on short-term. You will not believe. I had 58 hits yesterday, 58. And I'll tell you something else too. I've looked so fit into Airbnb. Women have made $70 billion in the 10 years that Airbnb That's worldwide. That's worldwide, but $70 billion has gone to Lynn. And their accounting process is that low. And that's really what we need to do this too. We need that software to be able to keep this thing going the right way and not infringe on the public.
Are you-
I believe we need to be all the time.
Are you providing your guests appropriate instructions as to where to dispose of their trash?
Yeah, we do that.
All right, good.
Side by side.
That's right.
I think it's good that we've kind of pulled the cap off the table for now too.
Yep.
Gives us a little more time to kind of look at it, and to the degree that we can mirror what the county's doing as far as the wording in their ordinances. In their ordinance is important, especially it just makes everything more seamless. And I think it would be good as we get towards the fourth quarter of our calendar year to offer people that window to go ahead and get their application in to be effective January 1, if that's what we decide to
Oh, I
do.
think that, yeah, I mean, that's why I say if it's October 1st to
Yeah,
maybe, I mean, I'm sure I can build in language if it's the will of the commission to state that the effective date of the ordinance is October 1st. The expectation is to have licensing
Yeah.
in hand by January 1st,
Yeah.
2022.
mhm.
I don't think that's an unreasonable thing. I think John and I could work pretty within that confine and I know he's had, because of the expectation that this was coming, I know John has had conversations with the third-party vendor. And I mean, as this it continues to be advertised, I get unsolicited emails. I know Naomi does as well from
Mhm.
these types of vendors saying, have you passed your ordinance? We'd like to,
Yeah.
talk to somebody. So this would be considered a first reading tonight if everyone is okay with it as it is drafted in form. So all I would need is the consensus for the city clerk's office to advertise, and then we'd bring it back
Okay.
next meeting for
Okay.
approval.
For approval.
Now,
Okay.
with the consensus being that I would adjust the dates, is that
Mhm.
what the commission would like to see done?
Yes.
Okay.
Yeah.
All right.
Mhm.
That's
Okay.
all I have.
Very good.
Wonderful. Thank you so much.
All right.
City Attorney Corey, I think we do have executive session items.
That's correct for the need of litigation.
All right, well, we will adjourn into.
I'll make a
executive
motion
session.
that we adjourn our scheduled meeting into executive session to discuss litigation.
Hearing a first. Hearing a first and second, all those approved, show by usual sign of aye. Aye. All those opposed, hearing none, we are adjourned into executive session. You need to. We are back from executive session. No action was taken. We will entertain a motion to adjourn. Hearing a first and a second, all those in favor, show by sign of aye. Aye. All those opposed, hearing none, the meeting is adjourned.